Hi, I'm Alain Labrique from the Johns Hopkins Bloomberg School of Public Health, and I'm also the director of the Johns Hopkins University Global mHealth Initiative. I'm here today to talk a little bit about the conversation that we've been having at the summit about evidence surrounding mHealth. And joining me is Garret Mehl from WHO. Garrett.
Hi, I'm Garret Mehl, a scientist in the Department of Reproductive Health and Research at WHO. And we've been working with Alan on a particular session on the role of evaluation and evidence from the perspective of different stakeholders.
Yeah, I think we had a really good session this morning where we had about 150 people join us in a conversation about the increasing importance that's been given to evidence in this space of mHealth, and the meaning actually of evidence in this space, depending on who's asking the question and what it is you are looking for in terms of evidence and for what purpose.
World Health Organization, we're very dependent upon the role of evidence. Our decisions and recommendations to governments are really dependent upon the strength of evidence, the quality of evidence, and we want to be able to identify and recommend to countries innovations and interventions that not only have a rigorous evidence base and demonstrate their health impact, but also that they're cost effective for countries that have limited funds.
And I think that's a very good point, because across the life cycle of innovation, as many people put it this morning, there are different stages of that life cycle where particular kinds of evaluation methodology are appropriate. When you're testing and developing a strategy, the randomized controlled trial is not the appropriate methodology, perhaps, to assess usability, feasibility, and stability of the system or widget that you're designing and deploying. I think it's important to focus on some best principles, foundational principles for developing good and usable technologies. Among those are, user-centered design, human-computer interface considerations, and that requires intensive use of qualitative methodologies, feedback from the end-user client who's going to be the deploying and using that technology. And I think it's important for us to appreciate what the users are expecting from this technology.